Hi, welcome to the Fit and Healthy Today show. Today our topic is peptic ulcers. And what those are, those affect the stomach or the duodenum, and it's an eroded spot. Literally, you have a stomach lining in which a spot gets eaten away. So it's an eroded spot, and under normal conditions there's a nice mucus layer in combination with certain, as I mentioned here, alkaline biocarbonates that work to prevent the acid from damaging the stomach lining. However, when these eroded spots occur, then they're wide open, and then regular stomach acids or anything that's spicy or is problematic can cause these areas to spread and get worse, or can cause them to occur. What causes peptic ulcers? Stress and anxiety on an empty stomach, bottom line. When you look at that, I think that's probably one of the major causes. They used to think it was primarily H. pylori bacteria, which is also a major contributing factor, but they're finding that stress and anxiety, because when you get stressed out, you excrete a lot of stomach acids into the stomach, and it can just kind of wear away at that lining. Medications such as aspirins, NSAIDs, Celebrex, Beniva, those types of alleged bone building drugs can contribute to that because they cause a lot of stomach acid secretion and upset. I mean, literally, I have customers that cannot take the medication because of all the stomach upset. Even though it's a once a week or a once a month type of drug, it causes them a lot of problems. Black and Latino populations are twice as likely to develop peptic ulcers, and we don't know exactly all the reasons why, but apparently just the types of foods that the genetics have been able to utilize and absorb. When you put them on a standard American diet, it seems to cause a problem with increased ulcer rates. Poor diet, poor nutrition. Nutritional deficiencies, if you don't have adequate amounts of L-glutamine, vitamin C, B vitamins, good bacteria, also known as probiotics, you don't have anything to keep that stomach lining strong. So therefore, when you do have a bad diet, or you eat bad foods, or you have a lot of stress going on in the stomach, then it allows those eroded areas to take place. Allergies. And I'm talking about food allergies primarily, because when you have foods that you're allergic to, they cause inflammation. And when you cause inflammation in the gastrointestinal tract, you get little spots of eroded areas, in this case, your stomach or your top of your small intestine. Smoking and alcohol make the body very acidic, and so do artificial sweeteners. Those types of things raise acidity levels in the body. And there's certain chemicals that are found in cigarette smoke that also make you more acidic. But alcohol, it's a pure sugar, and so when you drink it, particularly on an empty stomach, it can eat away your stomach lining, particularly if you're nutrient deficient. We discussed a little bit of H. pylori bacteria. Now, what's kind of funny is we have a lot of people that are on acid reduction drugs. You know, they'll take those drugs that will shut down the stomach pumps of acid. And what happens is these nice stomach acids keep the stomach lining strong, and they also prevent H. pylori from happening. So those people who tend to be on acid redox drugs have a much higher rate of the H. pylori bacteria infestation. The symptoms, a burning kind of gnawing pain, and it's kind of funny because a lot of people will think they're having a heart attack because the pain kind of just emanates. But it's a burning, gnawing pain in the upper abdominal, usually when the stomach is empty or within an hour after people have eaten something. So one of the offending foods that causes them tend to, acidic types of foods, or not having adequate amounts of stomach acids in order to break the food down, so it just sits in there and rots and comes back up again and eats away and forms one of those little ulcers. When we're talking about the right kinds of foods to eat, particularly when you have an ulcer, but these can also be used as a preventative if you've had them before. Tag I met. I've had ulcers many, many times diagnosed, and I always know now when I'm getting one, I pretty much can self-diagnose and know, uh-oh, too much stress, too much something going on here. I got to make things really, really clean, and then we'll talk about the supplements here in just a few minutes. Eating smaller meals with lots of fiber. Fiber seems to be able to absorb, fiber water kind of dissipates the stomach acids, reduces the inflammation in that regard, and eating smaller meals doesn't put so much stress on the pancreas and the liver and all your digestive tract, so it keeps the stomach where it digests small meals and it's gone. Eating several servings of leafy green vegetables. I got to tell you, I think most people, they're lucky if they eat a salad a day. Leafy greens, all greens, have a vitamin in it called vitamin K. And this vitamin K is very, very important in order for the stomach to repair damage from these gastric juices. If you get an ulcer, there is something that's not found very commonly around, but you can get it, or if you're willing to juice it, you can get it, juice it yourself, and that's cabbage juice. Or if you're like me, last night I made my mom's good old homemade sauerkraut, high in certain types of fermented types of acids, but it's very healing to the digestive tract. So a sauerkraut, cabbage juice, those types of juices are very healing, and you can mix them with a little bit of carrot juice if you want to, because obviously when you're drinking cabbage juice, yummy, yummy, not so great. Mixed with other things is okay. Eating garlic on a regular basis, if you particularly know you tend to have H. pylori bacteria problems, the garlic helps kill H. pylori. Garlic, oregano, a lot of the typical spices, rosemary, those types of things kill the H. pylori and other bacteria that form or that you ingest from a standpoint of illness as well too. Avoid sugar, spicy foods, citrus foods and juices, coffee, black tea, and then we already talked about alcohol. These are all things that are very, very, very acidic. Particularly throwing sugar on a wound, alcohol on a wound, coffee on an open wound. You can turn, with these types of foods, you can turn what may be a very minor ulcer, peptic ulcer, into what's called a bleeding ulcer. That's where you could be vomiting, blood coming up. More serious because you're actually bleeding internally and inside. So, if you got an ulcer and you know or been diagnosed with one, stick with good, smaller meals, leafy green vegetables, no juices, no coffee, no acids, no candy. Just make it nice and clean. Now, where I've had the best help with me in my fight against ulcers, and my mother included, and who knows whether it's genetic or not, I have a clean diet and I eat clean, but I'm a higher stress kind of person. That good old German heritage is just the way it goes. The number one thing that I found that heals and helps, I know when I have stomach ulcer issues, is licorice root, preferably diglyceride licorice. Diglyceride licorice lowers the blood pressure, or keeps the blood pressure down. Regular licorice can raise blood pressure up. Diglyceride licorice is also very good for the adrenal glands. It's very supportive of that. But 20 minutes before each meal, there was a study, actually more than one study, but studies support, I should say studies, found that it was effective as Tagamet or any of the other antacid medications at helping ulcers heal. So, before you go out there and start taking an antacid medication, thinning that lining further, and which will allow the H. pylori bacteria to eat even more of your stomach lining away, consider diglyceride licorice. For me, only option. My mom used to do all those acid reflux. She had ulcers 3-4 times. It was a continual problem for her. Mastic gum. There was a double-blind placebo study. What that means is they took two groups. One got the mastic gum and one got nothing, and neither of the parties knew what they were getting. And what they found with a product called mastic gum, and it comes in, it's not a chewing gum, it comes in capsules, and they found that there was 3 times the healing rate as a placebo, 70% versus 22% in the placebo. So very, very helpful with peptic ulcers. Aloe vera. As we know, when we get burns, we put aloe vera on it. Oh, it feels better. It cools the burn. Well, aloe vera internally taking is actually very, very healing. soothing to the stomach, and it's also antimicrobial. It kills bacteria and viruses and fungals and other things, but it can help heal that burning that you've got as well, and about 2 ounces 3 times a day. Probiotics, particularly if you're on an antibiotic, because a lot of doctors, if you get H. pylori bacteria that's causing an ulcer, they'll throw you on an antibiotic, which actually creates even more acids, so it kind of scratched my head on that one. But the good bacteria, lots of studies that supported it, really aided the recovery rate. In one study, it showed 2.5 times an increased recovery and not keeping a reoccurrence from not coming back or not having H. pylori reoccur when probiotics in a minimum of 4 billion of the little critters twice a day on an empty stomach. L-glutamine. Now, L-glutamine, there's a local oncologist I know, Dr. Walker, that recommends it to her patients, her chemotherapy patients that find that the chemo causes a lot of burning and that type of thing in the digestive tract, and the L-glutamine helps heal the intestinal lining. Well, guess what? It also helps heal the stomach lining, and I think Ralph 4 weeks ago or so talked about L-glutamine utilization for ulcers. It heals the lining by actually literally stimulating the cellular production of these mucus lining cells. Heals it right up. Same for the intestines, as and Dr. Walker uses it for chemotherapy patients. Essential fatty acids. Now, these can also be taken as a preventative as well as a treatment. And about 4,000 milligrams, a teaspoon a day minimum of fish oils, flax oils. What that does is that helps relieve or reduce inflammation and also aids healing as well in the stomach lining. There are several homeopathic medications. I wrote the most common one down that's utilized for ulcers called Nux vomica, because a lot of people get nausea and pain associated with peptic ulcers, and so the Nux vomica seems to be able to fight that as well. And homeopathics are one of the American Medical Association's first medications. They cause no side effects and they can be taken with any drug. Golden seal, used for a lot of things, but it's an antimicrobial. Studies supported it as being an excellent way to fight H. pylori bacteria-induced peptic ulcers. 500 milligrams 3 times a day. When you do golden seal, though, I would still suggest doing a probiotic. Bovine colostrum, and everybody's going like, what's colostrum and what's bovine? Okay, bovine is a cow. Colostrum is the first milk that comes out of mammals, including humans. Okay, that colostrum, we can get it in chewable or powders or in capsule forms. When you take it in, not only does it heal stomach ulcers, but it gets if it is bacterial cause, it causes the bacteria to clump off and go through the digestive tract and be expelled. So it kind of clumps them and isolates them so they can't replicate, and it's also extremely healing. It's kind of funny. There is some minor study work that's been done on babies and colic, and when mothers feed their first colostrum. The colostrum is the first, we really call it milk, but the first liquid that comes out of breast tissue that gives you the immune system and a lot of things, and they found a reduced rate of colic. Obviously a stomach condition, and if you're a parent, a no sleeping condition if your baby has it. So colostrum healing as an adult, colostrum healing as a baby. Oregano oil. There's a book called Cure in the Cupboard about oregano oil. Oregano oil is an antimicrobial that kills viral, fungal, and bacterial infections. Very effective if you can get past the taste, but we have them I know at my stores, we have them in little gel caps you can